I'm Dr. Barbie.
You're going to do an activity, a little Poggle, about some of the different actions that muscles can have on different joints. Flexion and extension are two actions that occur in a lot of your hinge joints, some of your ball and socket joints, and saddle joints as well. And so this is an example of flexion. This woman, starting from the anatomical position, is moving her forearm. Her humerus is flexing at the shoulder. This is her lower leg flexing at the knee. The opposite action then is to put that back into the anatomical position is extension. A lot of times flexion will reduce the angle between two bones, but sometimes it's just really moving it out of anatomical position. Angular movements like flexion and extension happen primarily in hinge joints, but can also happen in ball and socket and saddle joints. Sometimes a joint is referred to as hyperextending if it moves beyond its normal position or anatomical position. So here's an example of this woman flexing her torso, flexing at the hip, you could say, and this is her coming back to anatomical position is extension, and then going beyond that is hyperextension. Same with her neck, flexing her neck, back, extending her neck back to anatomical position, and then hyperextended. You may have heard of a hyperextended joint if you've bent your elbow or your knee farther than it should have and damaged some of the tendons that are holding it into place. You're going to learn about these motions. Abducting means to go away from the midline. Adduction means coming closer to the midline. Circumduction makes kind of a conical shape. Your foot is always in sort of a flexed position at rest, and so it has special names to describe its two opposite actions. Dorsiflexion is when you bring your toes closer towards your nose, and plantar flexion is when you push down on your foot. This is the plantar surface of your foot, so you're pushing it down, pointing it like a ballerina. Rotation happens in just a few places where your atlas and axis are articulate in your neck. Your atlas can rotate around your axis. You can also rotate your hips laterally and medially and your shoulders as well. Another special movement is supination, which only happens in your forearm. I think sometimes people refer to a supinated foot as well, but it's more obvious in your lower arm, where your radius can rotate around your ulna and cause these bones to cross over. When your hand is in the anatomical position, that is referred to as supine. And when you rotate it over so that the back of your hand is facing forward, that is referred to as prone. Some of my students help themselves remember which is supine and which is pronated by thinking about holding a bowl of soup in your hands when your hands are in a supinated position. You can use the words supinated and pronated to describe an entire body. If it's like laying on the floor with the ventral side up, it's called supine, and if it's splatted out face down, then you'd call that in a pronated position. Your feet, when they rotate inwards and outwards, use different terms called inversion and eversion, and sometimes my students get these words confused as well. So I usually remind them that Mount Everest is a pretty famous mountain, and if you were skiing down it, you might have to use yourself a great big snowplow, pushing on the medial portion of your foot to slow yourself down if you ski or wear a snowplow, and that puts your foot in an everted position. Some other special movements I think kind of just make sense. Protracting is pushing something forward, and retracting is bringing it back. You could do that with your whole head or just with your jaw. Another special movement is elevating and depressing. It's just like an elevator going up, and depressing is pushing down. You can do that with your shoulders as well as your jaw. And then primates have a special motion called opposition. Our thumb opposes all of our fingers, and that gives us our little unique ability to use our hands so effectively.